Hello. Tonight, we open an old case file, one that has never rested in peace. I'm in the digital archives of a university library, the air cold and dry, filled only with the quiet hum of server fans. On the high-resolution screen before me is not an artifact, but its ghost, scanned and magnified to its very fiber, the Ebers Papyrus, one of the oldest and most comprehensive medical documents in human history. My cursor hovers over the 47th column, a list of remedies for ailments of the eye. You may not want to be here when the truth of one of its listed ingredients comes to light. Before we continue, please like and subscribe, only if you truly appreciate this kind of investigative storytelling. If you have a theory about the logic behind these strange remedies, share it in the comments. Dim the lights, bring your skepticism, and let's open the file. The common accepted truth is that ancient Egyptian medicine was astonishingly advanced for its time. They possessed a detailed knowledge of anatomy. Gained through the process of mummification, they performed complex surgeries, and their physicians, the SMW, could diagnose and treat a vast array of illnesses, from dental problems to tumors. They were regarded as the medical masters of the ancient world, sought out and respected by the kings of other empires. The Ebers Papyrus, over 20 meters long and containing nearly 900 remedies, stands as the greatest testament to this wisdom. It lists ailments of the digestive and circulatory systems, dermatology, and even psychological afflictions like depression. But as we read closer, not in the diagnoses but in the prescriptions, a different, darker, and more visceral world begins to emerge. Here is the strange detail, a fact often omitted in the praise of Egyptian medicine. Alongside familiar herbs and minerals, the ingredients list for countless remedies include substances that make us shudder today: the blood of bats, the fat of hippos, the brains of turtles, the bile of crocodiles, the testicles of donkeys, and even the feces and urine of various other animals. These are not isolated cases. They appear systematically throughout the papyrus. A prescription for driving out fly-in-the-eye disease calls for the brain of a turtle mixed with honey. A remedy for baldness required the fat of a hippo, a crocodile, a cat, a snake, and an ibex, melted together and applied to the scalp. It is a lesser-known fact that these ingredients were not chosen at random. They were often selected based on a magical logic known as similia similibus, like cures like. But that logic sometimes led to bizarre and unsettling conclusions. This has ignited a fierce debate among medical historians. Were these gruesome remedies purely superstitious, the nonsensical magical practices of a civilization that did not yet understand bacteria and biochemistry? Or is there a sliver of primitive empirical observation hidden within them that we have missed? Some researchers argue this was entirely magic, with no medical value, but others pose more intriguing questions. The feces of certain animals, for example, contain mold species with antibacterial properties, the very precursors to antibiotics. Is it possible that the Egyptians, through thousands of years of trial and error, had accidentally stumbled upon some genuinely effective medicinal properties within these revolting ingredients? The Ebers Papyrus is not just a medical text. It is a case file on a worldview where the line between science, magic, and the grotesque was completely erased. And to understand it, we must delve deeper into the very logic that created it, To understand the bizarre prescriptions in the Ebers Papyrus, we must move beyond our modern scientific framework and enter the ancient Egyptian mind. Our investigation now focuses on the core principle that governed their pharmacology, a logic that feels both alien and strangely intuitive. The principle of sympathetic magic, or similia similibus, like cures like. The common accepted truth is that this principle is one of the oldest forms of magical thinking found in cultures all over the world. The core idea is that an object can influence another object if they share a resemblance or a symbolic connection. For the Egyptians, this was not a fringe belief. It was the foundational logic of their medical practice. A plant with yellow flowers might be used to treat jaundice. A red mineral like ochre could be used for blood disorders. This was the lens through which they viewed the natural world, a web of hidden connections and sympathies where every plant, animal, and mineral held a secret power linked to its appearance or behavior. But it was in their use of animal parts that this logic reached its strangest and most unsettling conclusions. Here is the bizarre detail. The characteristics of the animal were believed to be directly transferable to the patient through the consumption or application of its body parts. This wasn't just about using a strong animal to grant strength. The logic was far more specific. A lesser-known fact is that the testicles of a donkey, an animal known for its virility, were a key ingredient in remedies for impotence. To cure blindness or poor night vision, one might use the liver of an ox, or, as we saw in the previous section, the blood of a bat, an animal that navigates perfectly in the dark. The fat of a hippo, a massive creature with a thick hide, was prescribed for baldness, with the hope that its properties would encourage thick hair growth. It was a form of biological alchemy, a belief that one could literally ingest the desired traits of the animal kingdom. This application of sympathetic magic raises a fundamental question for historians of science. Was this simply primitive superstition, a pre-scientific attempt to impose order on a chaotic world where correlation was mistaken for causation? Or was it an early, albeit flawed, form of observational science where the Egyptians were trying to build a rational system based on the best evidence they had, the observable traits of animals? Some scholars argue that there is a clear distinction between the Egyptians' rational surgical practices and their magical pharmacology, suggesting they operated in two separate mental worlds. Others, however, believe this is a false dichotomy. They argue that, for the Egyptians, there was no line between magic and medicine. Magic was simply a technology of the unseen. A spell recited over a wound was considered just as important as the bandage applied to it. The symbolic power of an ingredient was as real and tangible as its chemical properties. The logic of similia similibus was not a guess. It was a diagnosis of a spiritual imbalance that needed a corresponding spiritual cure. Remember, the turtle brain used to treat an eye ailment? The logic might have been that the turtle, which can retract its head into its shell, possessed the power to retract the disease from the patient's eye. This was their science. And as we will see, this logic would lead them to use the fat of one of the Nile's most dangerous predators in a desperate attempt to solve a very common human problem. The body, now an empty vessel with a lone, silent heart, was ready for the next stage of its transformation. This was the point of no return, a chemical process that would irrevocably alter the human form, stripping it of its identity and reducing it to its most basic, enduring elements. The investigation now moves to the Wabet, the place of purification, a special tent or workshop where the most crucial phase of mummification took place. The common truth, known to anyone who has read about ancient Egypt, is that the body was desiccated using a special type of salt called natron. Natron, a naturally occurring mixture of sodium carbonate and sodium bicarbonate harvested from the dry lake beds of Wadi el Natrun, was the key to preservation. The body was completely covered inside and out with mounds of this granular white substance, which acted as a powerful dehydrating agent, drawing out all the water from the tissues and preventing the growth of bacteria that cause decay. But calling it a salt bath is a sterile clinical euphemism that masks a strange and horrifying reality. The body wasn't just covered, it was buried. Piles of natron were packed inside the empty chest and abdominal cavities, and the entire corpse was then interred in a massive heap of the salt on a slanted embalming bed, allowing the bodily fluids to drain away. For 40 days, the body lay in this silent, corrosive embrace. This specific duration is a lesser-known detail of profound significance. The number 40 was not arbitrary. It was deeply symbolic, mirroring the 40 days that the star Sirius, Sopdet, disappeared from the night sky before its helical rising, which signaled the beginning of the annual Nile flood and, with it, the rebirth of the land. The body in the natron was, in a ritual sense, undergoing the same journey of disappearance and renewal. During this time, the physical transformation was grotesque. The skin tightened and blackened, the features became gaunt and skeletal, and the body lost more than half of its original weight. What emerged after 40 days was no longer a person. It was a withered, leather-like effigy, a brittle shell that retained a human shape but none of its substance. It was a permanent, unchangeable state of being, a physical representation of eternity. This brutal process of desiccation leads to a core debate among historians and theologians. Was the 40-day natron bath merely a chemical necessity, the length of time scientifically determined by the embalmers through centuries of trial and error to achieve perfect preservation? Or was it primarily a ritual act, a spiritual ordeal, where the physical decay was a necessary metaphor for the soul's purification in the underworld? Some argue for the practical approach, suggesting that the religious symbolism was retroactively applied to a scientifically sound procedure. Others insist that the ritual came first, that the 40 days of dissolution in salt were a reenactment of a cosmic cycle, a mandatory rite of passage to ensure the body was spiritually pure enough for the next stage. The truth likely lies somewhere in between. It was a perfect fusion of macabre science and profound faith. The body that was lifted from the natron bed was a desiccated husk, a terrifying and alien form. It was ready to be remade, not as a human, but as a divine statue, a vessel ready for its final intricate wrappings and the magical incantations that would supposedly awaken its senses once more. The logic of sympathetic magic, where the traits of an animal could be absorbed by a patient, explains the use of hippo fat for hair loss, a desire to impart the creature's thick-skinned resilience onto a balding scalp. But the investigation now moves from the brute force of the river behemoth to the silent winged creatures of the night and into a medical field that was a constant struggle for the Egyptians. Ophthalmology. The common accepted truth is that eye diseases were rampant in ancient Egypt. The combination of desert sand, wind-borne dust, and the constant presence of flies carrying infections made ailments like trachoma, cataracts, and general blindness a part of daily life. As a result, Egyptian physicians developed a sophisticated range of treatments. They used mineral-based eye paints like green malachite and black galena, coal, which we now know have antibacterial properties to both decorate and disinfect the eyes. They had surgical instruments for procedures like cataract removal. This practical observational side of their medicine is well documented and impressive. But the Ebers Papyrus reveals a darker, more magical approach running parallel to these rational treatments. Here is the bizarre and unsettling detail. For conditions like poor night vision or even total blindness, a recurring prescription was bat's blood. The instructions were explicit. The blood of a bat was to be collected and injected directly into the patient's ear, or sometimes mixed into a poultice and applied to the eyelids. To the modern mind, the prescription is horrifying and nonsensical. Bats are associated with darkness, caves, and disease. Their blood seems like a vector for infection, not a cure. But to the ancient Egyptian physician, the logic was flawless. This is the lesser-known fact that unlocks the remedy. Bats are masters of the night. They navigate with perfect precision in absolute darkness. Therefore, according to the principle of similia similibus, their blood must contain the very essence of this supernatural ability. By introducing the blood into the patient's body, the physician wasn't treating a physical ailment. They were performing a magical transfusion, attempting to grant the patient the bat's power of night sight. This remedy forces us to confront the central debate surrounding Egyptian medicine. Was this practice a desperate act of pure superstition, a shot in the dark when practical remedies failed? Or could it be a flawed extension of a correct observation made elsewhere? We know, for instance, that the Egyptians also prescribed animal liver for night blindness. Modern science understands that animal liver is incredibly rich in vitamin a deficiency of which is a primary cause of night blindness. It is one of the few instances where their ancient remedies have a proven biochemical basis. The question then is this: did the Egyptians observe that one animal part, liver, could cure an ailment, and then incorrectly extrapolate that other animals known for a specific trait, like the bat's night navigation, must also hold a cure in their bodies? Some historians argue this is exactly what happened, that the bat's blood remedy represents a tragic misstep, where the magical logic overrode a genuinely scientific observation. Others maintain that we are imposing our own categories. For them, the vitamin A in the liver and the magical power in the bat's blood were one and the same, different manifestations of the life force, or sechem, that could be transferred to heal. This worldview, where science and magic were inseparable, would lead them to prescribe even more dangerous substances, moving from the merely strange to the actively hazardous in their search for cures. Our investigation has so far uncovered a disturbing pharmacopeia, a world where the symbolic properties of animals were believed to be directly transferable to humans. Hippo fat for baldness, bat's blood for blindness. These remedies were born from the logic of sympathetic magic. But the Ebers Papyrus and other medical texts, like the Cahun Papyrus, show that Egyptian physicians applied this same worldview to every aspect of life, including one of the most private and critical, contraception. The common accepted truth is that ancient Egyptian society was surprisingly progressive in matters of women's health and reproductive rights. Women could own property, inherit titles, and initiate divorce. Medical texts show a clear understanding of gynecology, with diagnoses and treatments for a variety of conditions. They also contain the earliest known prescriptions for birth control, demonstrating a desire to control family size that was far ahead of many other ancient cultures. But the nature of these contraceptives reveals a strange and dangerous intersection of observation and magic. Here is the bizarre detail that stands out in the papyri. One of the most commonly prescribed methods of contraception was a pessary, or vaginal suppository, made of crocodile dung mixed with fermented dough or honey. To the ancient Egyptians, the logic was, once again, rooted in sympathetic magic. Crocodiles were seen as sterile creatures, and their dung, therefore, was believed to impart that sterility upon the woman, creating a magical barrier against conception. The honey or fermented dough would act as a sticky base to hold the substance in place. It was a prescription born from a deeply symbolic and deeply flawed understanding of biology. This particular remedy is one of the most shocking in the Egyptian medical canon, and it has fueled a long-standing debate. Was this method, and others like it, a complete failure, a dangerous and unhygienic practice that likely caused more harm than good? Or, buried beneath the magical thinking, did it have some accidental rudimentary effectiveness? Some historians and gynecologists argue that the crocodile dung pessary was not just ineffective, but actively dangerous. Crocodile dung has a highly alkaline pH, which, while not a spermicide, could drastically alter the vaginal environment, potentially leading to severe infections, irritation, and long-term health problems. The risk of tetanus and other bacterial infections would have been immense. However, a lesser-known fact provides a counter-argument. Other scholars suggest that while the dung itself had no contraceptive properties, the sticky, dense paste of honey and dough could have acted as a primitive physical barrier, much like a modern diaphragm, blocking sperm from reaching the cervix. In this view, the Egyptians had stumbled upon a mechanically effective method, but had attributed its success to the wrong ingredient, the magical dung, rather than the practical paste. Remember the bat's blood and the animal liver? This could be another case where a correct observation was misinterpreted through a magical lens. They knew the method sometimes worked, but they credited the magic, not the mechanics. This dangerous blend of the practical and the magical meant that for every woman who might have been protected by a physical barrier, another may have suffered a fatal infection from a prescription handed down by the most respected physicians of the ancient world. The Egyptian physician's toolkit was a cabinet of curiosities, filled with animal parts and dangerous minerals. We've seen how remedies like crocodile dung were chosen based on a strange fusion of magical thinking and rudimentary observation. But our investigation now uncovers the final, indispensable ingredient in almost every ancient Egyptian prescription, the one element that was considered as vital as the physical components, the spell. The common, accepted truth is that Egyptian medicine was inextricably linked with magic. The roles of physician, Etu and priest, were often intertwined. The most revered doctors, like Imhotep, were eventually deified. For every physical remedy prescribed in the Ebers Papyrus, there was often a corresponding incantation that had to be recited for the medicine to be effective. This was not an optional extra. It was a core part of the treatment protocol. But the nature of these spells reveals a strange and fascinating detail about their worldview. These were not humble prayers asking the gods for healing. They were commands, legalistic pronouncements, and even direct threats. This is a lesser-known fact. Many medical spells are written in the first person, from the perspective of a powerful god. The physician, in reciting the incantation, was not just a doctor, he was an actor, a vessel channeling a deity to do battle with the malevolent forces causing the illness. For example, a spell to treat a burn might have the physician declare, "I am Horus's son, I will not be burned." By saying this, he wasn't just soothing the patient, he was magically embodying a god to repel the fire demon. Illness, in their view, was rarely a natural occurrence. It was an attack, an invasion by a ghost, an angry god, or a demon. The medicine was the physical weapon, but the spell was the spiritual authority that gave the weapon its power. This performative, almost aggressive approach to healing has sparked a significant debate among medical historians and anthropologists. Was the magical element of Egyptian medicine simply a form of psychological comfort? A primitive placebo effect designed to give the patient confidence in the often unpleasant treatment? Or did the Egyptians believe these spells had a tangible, physical power to alter reality and compel both demons and deities to obey? Some scholars argue for the placebo interpretation, suggesting that the elaborate rituals and authoritative spells were a sophisticated form of bedside manner, calming the patient and allowing the body's natural healing processes to work. Others, however, insist that this view is anachronistic. They argue that for the Egyptians, words had power. The act of speaking a name gave one power over the named entity. A spell was not a suggestion, it was a weaponized utterance, a tool as real as a bronze scalpel. The patient was a battlefield, the physician was a divine warrior, and the incantation was the battle cry. Remember the dangerous crocodile dung pessary? It wasn't just applied, it was likely inserted while the physician recited a spell to banish the demon of fertility, making the magical and physical barriers inseparable. The final section of our investigation will now assemble these pieces: the gruesome ingredients, the flawed logic, and the magical commands, to render a final verdict on this strange and terrifying science. Our investigation into the ancient Egyptian pharmacopeia is now complete. We began with the Ebers Papyrus, a testament to medical wisdom, only to find it filled with prescriptions that defy modern logic. We have journeyed through the principle of sympathetic magic, a worldview where the traits of an animal could be ingested as a cure. We've examined prescriptions of hippo fat, bat's blood, and crocodile dung, remedies born from a blend of keen observation, flawed logic, and profound magical belief. And finally, we've seen how the incantation, the spoken spell, was the final indispensable element that activated the medicine. The common accepted truth is that Egyptian medicine, for all its strangeness, laid some of the earliest foundations for rational science. Their knowledge of anatomy, their surgical skills, and their use of certain effective herbal remedies are undeniable contributions to human history. But as we assemble the evidence from this case file, the final conclusion is far more complex and unsettling. The true, strange nature of Egyptian medicine is not a simple story of primitive science. It is the story of a system where the grotesque and the sacred were one and the same. This is the final, lesser-known fact. There was no distinction between a physician who prescribed a verifiable herbal remedy and one who prescribed a dangerous concoction of animal parts. They were often the same person, operating from the same unified theory of everything. The effectiveness of a cure was not judged solely on whether the patient recovered physically. Its success was also measured by its ritual correctness, its symbolic potency, and its ability to combat the unseen forces of chaos. The patient was not just a body to be healed, but a soul to be defended. This holistic, magico-scientific approach leaves us with the final, enduring debate. Was Egyptian medicine a success or a failure? From a purely modern biochemical perspective, it was a minefield of dangerous and ineffective practices, where any occasional success was likely due to accident, the placebo effect, or the body's own healing power. But from an ancient Egyptian perspective, it may have been profoundly successful. It provided a coherent framework for understanding a terrifying and unpredictable world. It gave patients a sense of agency, a belief that even the most fearsome disease could be battled with the combined power of nature and magic. The horror we feel when reading these prescriptions comes from our modern separation of science and belief. For the Egyptians, they were two sides of the same coin. The turtle brain and the crocodile dung were not failures of science. They were applications of a different kind of science, one that operated on the laws of sympathy and magic. This case file must therefore be closed not with a simple verdict of right or wrong, but with a chilling acknowledgement. The history of medicine is a history of worldviews, and in the world of the ancient Egyptians, the path to healing was often indistinguishable from a descent into a ritual of blood, faith, and fear. The digital image of the Ebers Papyrus fades from the screen, and we are left in the quiet hum of the server room. The file is closed, but the unsettling nature of its contents lingers. The remedies of ancient Egypt are not just historical curiosities. They are a stark reminder of the desperate and often dangerous lengths humanity will go to in its fight against death and disease. The logic of like cures like seems primitive to us now, but are we so different? We still seek the strength of the predator, the resilience of the ancient tree, the properties of the rare mineral, only now we seek them in the sterilized, synthesized form of a pill. The Egyptian physician's belief that words had the power to heal, that a spell could be a weapon, echoes in our modern understanding of the placebo effect, where the patient's belief in a cure can become a self-fulfilling prophecy. The horror of their medicine is not that it was so alien, but that, in some fundamental way, it is so familiar. It reveals a timeless human impulse to find patterns in chaos, to seek power from the natural world, and to believe that we can command reality if only we speak the right words. And that leads to a final haunting question. Centuries from now, when future historians open the case files of our 21st century medicine, Which of our most trusted cures and treatments will they look upon with the same mixture of awe and revulsion? Which of our scientific certainties will seem to them like a strange and dangerous magic?